Ultrasound imaging with color Doppler quantification is an important tool in treating patients with rheumatoid arthritis. Inflammation is the core of rheumatoid arthritis, and if you can't measure inflammation, there's no way you can gauge your treatment. Traditionally, we look at inflammation in the mind's eye and grade it as 0, 1, 2, or 3, as per the rheumatoid arthritis semi-quantitative scoring system. But the measurement with the eye is not accurate. Color Doppler makes it very easy to quantify information and recommend the best treatment or assess how well a treatment has worked. Color Doppler quantification is not only very effective, it is a simple procedure that takes only a short time. I would like to demonstrate. Here's one of my rheumatoid arthritis patients. She visited 14 days ago with a flare-up in the wrist. I scanned her with color Doppler to quantify the inflammation, and then I injected her with a steroid. Today, she's here for her 2 weeks follow-up to see the results of the injection. We'll repeat the color Doppler exam and then compare the results with what we saw previously. I start the exam by placing my transducer in the central portion of the wrist. I activate Doppler to see the perfusion, and as you can see, there is absolutely no Doppler activity in her dorsal wrist. We can see the slightly thickened synovium, but there's no Doppler activity to see. I repeat that on her thumb side of the wrist, and again, there's no Doppler activity. And I then repeat it on her little finger side and find absolutely no Doppler activity. The patient responded very well to treatment and has no Doppler activity, and we have nothing to color quantify today. But let's, for the purposes of this demonstration, take a look at her old exam 14 days ago. So I call up her scanning from the central portion of the wrist, and you can see the Doppler activity, and then the color quantification here shows that it was 39% in the central portion of the wrist. I call up her thumb side of the wrist, 17.8%, and her little finger side, 6%. So the patient has responded extremely well to treatment, and I will not continue injecting her with steroid. Now, had she, for instance, had lower color fraction than 21%, but let's say 6% today, I would have re-injected her wrist based on that information. Only by using color Doppler quantification will I be able to measure this decrease in activity. So because of color Doppler, we are able to compare the disease activity before and after treatment and measure the results of the treatment. The use of color Doppler is a very beneficial development in the treatment of rheumatoid arthritis.